Although essentially anybody could be at risk for developing CTEPH, there are certain populations, certain patients that we are more concerned about. As we understand, CTEPH starts with an initial episode of blood clots in the lungs or pulmonary embolism. And as such, anybody that's had a blood clot in a vein in the legs, for example, something called DVT, deep vein thrombosis, or phlebitis, or a pulmonary embolism can develop CTEPH. Several other types of patients are even more at risk for developing CTEPH. For example, we know patients with cancer have a higher risk of blood clots forming because the cancer changes the blood, so they're at higher risk for CTEPH. Similarly, there are patients who have various blood diseases that change how the blood clots, and they're at more risk for developing CTEPH. There are some other unusual conditions. People that have chronic inflammation of the bones or of the liver, for example, can develop CTEPH over time. There are some rare clotting diseases that people have that are genetic, that run in families, that put them at risk for developing CTEPH as well. And then a couple of other unusual things, patients that have had a pacemaker put into their heart, if that gets infected, that can put them at risk for CTEPH. As well, there are patients that have special surgical drains put into the brain to drain the fluid from around the brain to prevent high pressure, and they're also at risk of developing CTEPH. Finally, patients that have had their spleen taken out either after an operation or, for example, a car accident are also slightly at higher risk for developing CTEPH.